Welcome, esteemed guests from Chicago Maternal and Child Health Coalition. My name is Dara Shin, and I am the program manager for the proposed school-based program to prevent teenage suicide in South Lawndale, Chicago. There is currently a high incidence of suicide amongst high school students in South Lawndale in Chicago, Illinois. Suicide is one of the 10 leading causes of death in the United States. There are several environmental factors of South Lawndale that may cause a teen to fall into depression and attempt suicide. South Lawndale is in the west side of Chicago, Illinois, and the population is predominantly Hispanic and is marked by higher poverty levels and lower income per capita compared to the average city in Chicago. Other environmental factors include lower education levels, where 58.7% of the population having no high school diploma, and it ranks 47th among 77 community areas in Chicago for violent crime reports. Proximal influences affect teenagers as they are surrounded by peers at school and they cannot escape the community in which they live in. In his article, Zimmerman found that neighborhood violence and adolescent individual violent aggression in the form of suicidal attempts was positively correlated among Chicago neighborhoods. Hispanic immigrant community and minority youth, along with their families, struggle with adapting to a new culture with language barriers and societal biases. The stressors of being an immigrant youth, in addition to other stressors such as increased exposure to violence, poverty, and dysfunctional family life, can lead to depression and suicidal ideation. The culture of violence and loss of hope of promotion in society may cause teenagers to prey upon each other with bullying. Health behavior is complex, and there are many factors that influence an individual's behavior. These determinants of behavior can be environmental and social, influenced by society, peers, and family. At the individual level, programs are needed to help teenagers deal with stressors in a healthy way so that they do not fall into depression and suicidal ideation. There are hospital-based courses or programs that help high-risk teenagers deal with depression and substance abuse. Both factors lead to suicidal ideation. These programs are effective because they recognize that depression is related to multiple determinants. Factors that lead to depression include mental illness, stress, family relationships, stress, peer relationships, low self-esteem, violence, grief, etc. This type of program encourages a teen to think about different ways to manage stressors and other factors that may lead to depression and suicidal ideation. At the interpersonal level, bullying and stress relationships with family members and peers are determinants that may lead to depression and suicidal ideation amongst teens. It is difficult to fix a troubled home life, but there are ways to take teens away from toxic environments. After-school programs can also take teens away from a troubled home life, violence, or a toxic environment that may cause them to feel anxious or depressed. Social marketing and health education at the community level can help raise awareness and prevent bullying amongst teenagers on school campuses. At the organization level, schools must build a culture that's intolerant of bullying on campus and cyberbullying as well. Cyberbullying is strongly related to suicidal ideation because a broader audience is reached through the internet and the victim is more vulnerable to peer scrutiny. It is important to punish bullies, but it is equally important to provide proper counseling and support to victims of bullying. At the organizational level, it is important that educators and community leaders do not hold biases but treat all their students equally with dignity and respect. For example, educators set an example of how minority youth should be treated. They should be aware of the stressors that the minority youth face that may predispose them to depression and suicidal ideation. Also, at the organizational level, education status can be a risk factor because low education achievement is correlated with suicide risk in teens. At the community level, neighborhood violence can be a risk factor for increased teenage suicidal ideation. At the policy level, the government needs to pass laws to decrease crime and violence in different communities. Also, at the community level, research has found that immigration status is a social determinant of mental health and that U.S. citizen children of undocumented Mexican parents face the fear of immigration enforcement. As a result, the risk of depression and anxiety that can result in suicidal ideation may be higher than their peers. Loss of supportive school network and violence were cited as reasons for depression by citizen children with parents facing deportation. A program is needed to provide health resources to those who fear seeking help because of fear of deportation. A bilingual program is needed to empower those who cannot speak English and are less likely to seek health care or counseling. A case study in Chicago found that a minority youth development program is essential in not only empowering the children of immigrants but the immigrant community as a whole. Youth resilience is important in communities that are vulnerable to the current immigration enforcement laws and the health care reform that is taking place in the U.S. As a program manager, I will develop different programs that can be implemented at different levels of the social ecological model to influence the teenage suicide rate. At the organizational level, I will develop after-school programs, tutoring programs, and study halls where educators can give extra help to vulnerable students, and that could improve their performance in academics. Empowering high school students to achieve academic excellence gives them a purpose to live and channels their energy in a constructive way. At the community level, I would develop a social marketing and health education program to help raise awareness and prevent bullying amongst teenagers on school campuses. This intervention will not only teach victims of bullying how to interact with difficult people, but will teach other teens how to stop bullying when they see it occur. Social marketing and education is so important for everyone in the community. In fact, at the policy level, I would develop a program to educate lobbyists and government officials on the impact that community crime has on the teenage suicide rate. As a program manager, I would develop a program at which risk teens participate in sessions with their parents and therapists to develop a safety plan with problem-solving activities to regulate emotions and handle distress. This gives the teen awareness of emotional spirals and depression that may result from their difficult situation. The technique used is the helping relationships approach, in which the family acts as a support group for the teens. This will prevent feelings of isolation and improve stress relationships at home. Last intervention would be to train counselors, health care providers, and educators to refer high-risk teens to external services. This intervention is effective because it recognizes depression is related to multiple determinants, and it can address specific factors that may cause increased depression or suicidal ideation, such as mental illness, substance abuse, abusive home life, violence, grief, etc. Referrals of high-risk teens will be made to external services including medical care, behavioral health, social or substance abuse rehabilitative services, etc. These interventions and the outcomes are all summarized within the following logic model. The goal is to decrease suicide attempts amongst adolescents 12 to 18 years of age by at least 50% within 1 year in South Lawndale, Chicago. Ultimately, decreased suicide attempts within the population will signify success. However, the goal is also to decrease the depression and suicidal ideation within the population. Thus, a validated questionnaire will be given to all high-risk teens that go through an intervention program. Baseline data will be collected using this questionnaire to assess degree of depression and suicidal ideation, as well as number of suicidal attempts before and after the intervention. Teens that complete an intervention program will be assessed with a questionnaire at the 3, 6, and 12-month follow-up visits. The challenge to implementing any intervention program is the lack of funding. It will also be challenging to identify high-risk teens within the community. In addition, because we are working with minors, it will be challenging to obtain parental consent in working with these minors. The solutions to these barriers are quite simple. First, There needs to be more funding to pay for the implementation of any intervention program. In addition, community members, including policymakers, leaders, researchers, healthcare professionals, educators, and parents need to collaborate to develop the best intervention to prevent suicide amongst teenagers in South Lawndale, Chicago. Thank you so much for your time.